There's really no other way to say it. I know you've tried every day. It's hot outside, and it seems like it's much hotter than normal, and that means lots of sunshine and, of course, the need for sunscreen.
Yes, but what kind of sunscreen is actually good for you and the environment as well? Kirsten O'Connor, she's on assignment today, so Bridget is standing in to ask a doctor.
I've been reading up a lot about this lately, especially as some places like Hawaii have started banning some of the products that could harm our coral reefs. But we know in the Sunshine State that sunscreen is a must. So we have Dr. Neil Sandhu here today from Poinciana Medical Center to help us figure out how to get the best protection. Thanks for being with us, Doctor.
Thank you for having me. Thank you.
Sun protection is so important, especially in places like here in Florida where we are outdoors a lot, and skin cancer is a reality. It's a big problem.
Yes, for sure. With great sunshine comes great responsibility. Excuse me. So sunscreen is a really important thing. I advocate everyone, including the state of Florida, to wear sunscreen. The most important thing about sunscreen would be SPF, which stands for sun protection factor. So that's the main key thing you want to look for when purchasing a sunscreen product.
Now, when I'm looking at sunscreen, I mean, there's so many different types. There's, low SPF and then, up above 100. And there's been some debate about, which one is really effective and, just how high do you need to go? Does it depend on who you are or what type of protection you need?
Well, overall, the recommendation is to get an SPF at least 30.
Okay.
I actually advocate for 45 or 50 or above because we generally don't put enough. So generally speaking, we should put about a shot glass full each time we apply sunscreen. Wow. And we should be putting that every 1 to 2 hours. So we generally don't put enough. So if the minimum recommendation is 30, and being in Florida, we have a lot of UV radiation here, I tell patients to try to use 50, 45 at minimum.
So now when you say a shot glass of sunscreen, that's if you're like fully exposed, like at the beach or something like that all day?
Yes, on sun exposed areas, fully exposed at the beach generally, yes.
Now what about just for everyday use? Because you recommend sunscreen on a daily basis.
Absolutely. So I tell patients just to put their sunscreen right next to the toothpaste. So every single day putting on at least a physical sunscreen as well as a chemical sunscreen. So
but would you just worry about the areas that are showing, exposed to the sun on those daily basis?
On a daily basis, generally you want to put on the sun exposed areas, so the face, neck, but a lot of places people forget about is around the eyelids, the ears, the back or nape of the neck, the hands, the arms. So those areas we tend to forget. We kind of just put it on like a moisturizer on our face, but we have to keep in mind those key areas where we get a lot of sun exposure.
Now, what if you have some sun damage? When should you be worried, or when should you come in, to see someone if you think maybe something's not right with this freckle or this mole or skin patch?
Sure. So there are like the ABCDEs of melanoma, which is one of the most deadliest type of skin cancers. But generally speaking, anything that's changing, anything that's new, particularly if it's hurting or bleeding or sore, or even changing color, anything that kind of may be seeming out of the ordinary, I'll tell people to really check their skin every month.
Okay.
So on a daily basis, maybe having someone help them behind their legs, their back, kind of hard to look at areas, but generally try to look at your body every month.
Because it can be sneaky.
Yes, it can be. So I generally tell patients to come in every year to get their skin checked, especially living in Florida. So we can do kind of we call a full body skin exam. So we're able to look with different microscopes and different hand pieces. We can look at particular moles a little bit close up that you couldn't otherwise do at home.
Yeah, I really worry about the scalp as well. I mean, because that's a sensitive area for a lot of people, even if you have hair.
Yeah, so scalp can be affected too, especially if you have lighter hair or in men who we don't have enough hair when we get older. So we have to be conscientious of putting sunscreen on there and also wearing hats, especially speaking of hats, wide brim hats, so we're getting enough shade, covering our ears and our entire scalp too.
Okay, so let's talk about these chemicals because there's been a lot of talk about the chemicals. The FDA has been talking about 12 different chemicals, oxybenzone particularly, maybe affecting hormones in some different tests, and also affecting our reefs. Some areas even banning sunscreens with it. What's going on?
So they did a study showing that the coral reefs might be undergoing bleaching, which means that it's losing its color, losing its viability, and also marine life consuming a lot of the chemicals, particularly oxybenzone and octinotate, which are two common sunscreen ingredients. However, it's never been shown to be harmful to humans. So there is still needing to be more research to understand the effects of this, but overall the FDA is still recommending patients use sunscreen on a daily basis and have not banned such use. These sunscreens have been in use for decades and have been shown to be very safe in humans, have not shown any harmful effects.
But if you are worried, what should you look for, I guess, to sort of avoid that?
Yeah, so I like the physical sunscreens. They're also called mineral-based sunscreens. Those are titanium dioxide and zinc oxide. So you want to look for those two ingredients. Those have been shown to be generally safe for the environment and for humans. They also have broad-based sunscreen protection, meaning they block UVA and UVB. Those are the rays that can cause sun damage and skin cancer. So you generally will look for those mineral sunscreens, and they're very safe for patients, 6 months and up. So they're generally safe for even babies to use.
All right, Dr. Sandhu, thank you for being with us.
Thank you
Great
so much.
advice, and we just need to use that sunscreen because that sun is so intense out there.
Absolutely, thank you.
All right, back to you, ladies.